Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is the top 10 things you should know about stem cell procedures. Stem cell procedures for musculoskeletal conditions are now a reality. They are mainstream. At first, it used to be that you'd only hear about them in high-level athletes, such as people like Heinz Ward or Bartolo Colon, Tiger Woods, Rafael Nadal. Not anymore. Now you hear about it in recreational athletes, seniors and those who are trying to avoid a joint replacement, and even minor league athletes. First thing to know is that modern stem cell procedures have no ethical issues. Okay, there's no fetal tissue involved. There's only adult stem cells or amniotic derived. The amniotic ones come from consenting donors after a scheduled C-section. There are no embryonic stem cells either. Second thing is that they're showing promise for a lot of different issues: degenerative and rheumatoid arthritis, SI joint, spinal joints and discs, tendinitis, including Achilles, rotator cuff, elbow, plantar fasciitis, ligament injuries, sports injuries, diabetic wounds that simply will not heal, do great with stem cell therapy, and stress fractures, and even fractures that just aren't healing, non-unions. Stem cells are like a blank slate. Okay, they start from an undifferentiated state and they convert into any number of necessary cells. Okay, this could be a skin cell, cartilage, tendon, ligament, muscle. They turn into whatever they need to and whatever their environment tells them to turn into. Okay. Fourth thing to know is that they can actually heal injury. Traditional treatments, such as with steroid, act as a band-aid and don't heal anything. They just provide pain relief. Not so with these. The regenerative medicine stem cell treatments offer the potential to actually heal the damaged soft tissue and cartilage. This is truly cutting edge. It helps get athletes back on the field faster, helps patients avoid the need for surgery, and it can delay and avoid the need for joint replacement. Fifth thing is that the current treatments do not use embryonic stem cells. Okay? The use of adult stem cells in research and therapy is much less controversial than embryonic because their production does not require the destruction of an embryo. Amniotic fluid stem cells are actually intermediate between embryonic and adult. They do have some potential to develop into different cell types, but they are not pluripotent. It's actually good. If you're dealing with pluripotent stem cells, a lot of times they don't know when to stop replicating. Okay? So you can end up with a tumor. But the stem cells we use now know when to stop. There are 4 different types of regenerative medicine procedures. The first would be bone marrow derived. That's when the physician will take some bone marrow from the patient with sedation, possibly, maybe just some numbing medicine. But basically take about 60 cc's. It gets processed through a centrifuge machine, and then what results is the concentrated stem cells and growth factors, and that gets injected. Fat derived, adipose has a lot of stem cells in it, just like bone marrow, so that's often used. Amniotic derived actually doesn't come from the patient at all. It comes from consenting donors after a scheduled C-section. Amniotic fluid has a ton of stem cells and growth factors in it, as well as hyaluronic acid. It goes through an FDA-regulated lab and is processed and then cryogenically preserved. It actually does not cause any rejection reaction. It's called immunologically privileged. Okay, so you can take someone else's amniotic fluid and inject it into your knee after it's been processed. And the fourth type is PRP therapy. It's actually not a direct stem cell therapy. It has platelets and growth factors in it, but it calls in the body's stem cells when it gets injected. So it's an indirect stem cell therapy. Number 7 is that amniotic-derived stem cells have several amazing qualities. As mentioned, they're obtained from consenting donors after a scheduled C-section. They're processed at an FDA-regulated lab, and they contain impressive qualities: high concentration of stem cells, hyaluronic acid, growth factors, proteins, and they're also antimicrobial, so they resist infection. They've been used tens of thousands of times worldwide without adverse events. Number 8, small studies to date are showing excellent results for all types of conditions such as knee arthritis, epicondylitis like golfers or tennis elbow, degenerative disc disease, plantar fasciitis, ligament injuries, rotator cuff injury, and Achilles tendinitis and tears. These are not yet covered by insurance. Despite the exceptional results being reported, it usually takes insurance companies several years to cover up to covering new technology. The cost of the procedures is going to range. If surgery can be avoided, that can save considerable cost and disability. So you have PRP therapy, which is anywhere from $500 to $1,000, and then the stem cell therapy, which is anywhere from a couple thousand, up to like $5,000 or $6,000. Number 10, these are outpatient and exceptionally low risk procedures. PRP therapy involves a simple blood draw. The fat and bone marrow derived are autologous. They come from yourself. Okay, then they're processed and put right back in. The amniotic derived procedures have a long track record of tens of thousands of uses without adverse event. So overall, they have a very, very low risk profile. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are several clinics throughout the state accepting over 50 insurances for regular pain management. For the regenerative medicine, as mentioned, it's not covered by insurance. There's over 25 different treatment options available at the network affiliated clinics with the board certified doctors. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.